weighed in the research that was done on the side effects. Side effects are very important, right? I want to know what this vaccine could possibly do to me. So I looked at the different research, looked at the side effects, and what I found was the main side effects were flu symptoms, cold symptoms, fever, chills, things like that. Local side effects, a sore arm, swollen arm, redness, stuff like that. All right, I can deal with that. Okay, the side effects wasn't as bad. Now, as I was looking at the side effects and doing my research, I got a bing on my phone in regards to Bell palsy, right? I received a video of an African American nurse who had Bell palsy, and she had her video saying, "Don't get the vaccine." Do you know what Bell palsy is, by the way?
Yeah, when your side of your face goes limp.
Right. You know this, right? Get paralyzed. So she was out there saying, "Don't get the vaccine. This can happen to you." And it was very jolting when I was looking at the vaccine. I really felt bad for her. I said, well, let me take a look at this Bell palsy, because now everybody comes Bell palsy, don't get it. So I looked at the research. In the research, I found that it was 7 folks who got Bell palsy who was in the research of hundreds of people, right? But of those 7 people, they did not ascertain whether it was because of the vaccine or not. But of those folks, 5 of them that I researched have resolved on their own, right? I said, okay, so 7 people. I watched that girl video again. I said, let me do a little bit more research. So I looked to the Neuro Association, right? And they had all that stuff about neurological conditions like Bell palsy. So I looked that up. What I found was that 40,000 folks all year in the United States get Bell palsy just because. Some people get it due to medication reaction, but other people just get it just because. 40,000. And those folks resolve just as it comes out of nowhere, it resolves out of nowhere, right? So once I got that information, I dispelled that. I was fine. I don't have a problem with that. You know, her information about Bell palsy, sorry what happened to her, but that was not necessarily connected with the vaccine. So 40,000 a year, I'm not worried about Bell palsy. So I went on with my research, right? So I weighed in the side effects of those who are already taking the vaccine around me, right? Because I got hundreds of people signed up and actually got the vaccine. I have actually given the vaccine to hundreds of people myself, personally. Those folks are still fine, still walking around, still good. I had a couple people on the second dose who got cold and flu symptoms for a couple of days and then was fine. And typically, if you're gonna get some side effects, it'll be on the second dose when you feel like you got a cold or the flu. I can deal with that. All right. So I moved on. I weighed on my profession and my love for my community. Not to say that if you decide not to get the vaccine, you don't love your community. For me, I'm heavily in the community and promoting health and health equity. So I certainly have to stand on my word, right? And I also weighed in the Real Talk. I do live Real Talks all the time. Facebook Live and Real Talk is exactly that. Real Talk is very interesting. You have to catch one on Facebook or on YouTube. So I had to weigh all that stuff in and come up with my decision to get this vaccine, right? I got Pfizer. I'm fine, first and second dose, but it wasn't a decision that I entered in lightly like marriage. I entered into it lightly. So I went and got that vaccine to make sure it was good, right? So what I say to you is, you have to make sure that you're making an informed decision. Whether you say yes or no, at least it's informed and you know what you're dealing with, right? It's not all about what you heard or what you think, because that's not necessarily how it really is. And again, you have these cards, you can click on that QR code, you can ask us questions, you can call a phone number, whatever you need. Anything that you are confused about, we're more than happy to explain to you. So we got the Pfizer and Moderna, right? We just got Johnson & Johnson, the 1 shot. And I'm gonna leave that on the table. That's 66% effective. Pfizer and Moderna is 94 and 95% effective, but you have to get the 2 doses.
A good point about that, I just read not to intercede. That's on transmission efficiency. They're both 100% at preventing severe or death cases. Pfizer, Moderna, and Johnson & Johnson. So it's just another thing that people read 94 where there's already 6%, or people read 66 and that's 34%. But in terms of preventing serious cases, hospitalizations, and deaths, they're all 100% off across the board. So it's just another thing that promotes the vaccine.
Right. I'm gonna promote what he just said because I'm not waiting for death and I'm not looking for death. People are walking around here who are up walking, working hard. I need to let those people know, get the vaccine. I'm not waiting for you to get on your deathbed. I'm not waiting for you to get in ICU. None of that, because some of that data is skewed. I want you to be proactive in your healthcare and get this vaccine, and we can all help each other by getting protected and getting this vaccine. Okay, I think that's very important to know. So, who can get the vaccine, right? 65 and older, of course you can get the vaccine. That was the first group, right? You have first responders, healthcare workers, school employees, and comorbid conditions, right? And I just want to talk a little bit about comorbid conditions. You hear that word a lot. Does everybody know what that means? Comorbid condition? If you have one or two conditions going on at the same time, right? There's comorbid conditions. And it's funny because COVID-19 put people of color, black and brown people, at higher risk of COVID-19, right? But we also have the higher number of comorbid conditions as well. So things go hand in hand. So comorbid condition, I just want to go through a little bit of this with you so you can understand what that means and understand about your eligibility, right? Cancer, right? Cancer is one of those comorbid conditions. We kind of know that. That's kind of self-explanatory. Chronic kidney disease. You on dialysis, and I found that people who are on dialysis, they were some of the first people who got the vaccine to actually come to the dialysis centers. I thought that was great. Pulmonary disease. You have asthma. You're eligible. You have COPD. You're eligible. These type of things. Cystic fibrosis. You're eligible. Right? If you have a disability, you're eligible. Heart condition. If you have high blood pressure. Coronary artery disease. Those things make you eligible to get the vaccine, right? If you have an immune disease, supposing you have HIV or a type of illness like that, or you're on chemotherapy, or if you have seeds from prostate cancer. A lot of people have seeds, you don't even know that they have seeds for prostate cancer, right? These things make you eligible, right? And oftentimes people feel that I'm not going to get the vaccine because I'm done